Time for our first edition of Wellness Wednesday 2025. Dr. Bradley Meyer at Okoboji Wellness Clinic. It seems like forever since we talked to you.
I know. So happy to be back with everybody. Happy to be back on the air with you, Dave. It's been a few weeks.
Yeah, it's great to have you. Now let's get started with what people do every year. It seems like they want to get a little more interested in their health journey, whether it be exercise or weight or just feeling better. And that, of course, means that you can play a role in that for folks.
Absolutely. It would be our privilege. And you know, it tends to be this time of year, like you were saying, that folks will take a look back and a look forward and get an analysis of where they feel they are physically from a health perspective as well. And we are here to be with you on that journey, as always. You know, in this morning it was interesting. My wife and I were having a conversation about this young gal that came into our clinic that's a J-term student, and she just said yesterday to me, "This place feels different." This is a high school student, which is J for January term. She's like, "This place feels different than any other medical facility or clinic I've been in before, and I like it." And you know, that struck me and caused both my wife and I to kind of reflect and say, What is it? What is it about what we're trying to do in our path forward as a team here to help individuals that come forward that are looking for a new start or to get started again? And one of those big things is authenticity for us here, and that's the one thing that I've always prided myself on. I'm a what you see is what you get with me. I'm not going to put any false pretenses out there, and I love to get to know folks, their stories, and when I'm getting to know you, and when you take that step to come into the clinic and get to know us and our integrative team here, it's a special process because. Another gal that came in yesterday, she shared with me when she comes here, she feels like she's coming home, and home is a good thing for her. So, just an honor to kind of take that perspective and that stance and provide that kind of feeling to folks. Because we're here, and I'm here and the team is here to guide you. We want to create that plan for you, and we want to see you take that action in wellness and reach your goals. We want to see you living your best life, bursting with energy as we pop into the new year here. So many folks, as we always talk about over the last year or so, it's the brain fog, it's the wish I had more energy, and it's I wish I had less pain. And many times those things hold us back from reaching our best selves, or being the best dad we can be, the best granddad we can be. And so that's a big factor. And so, you know, we continue to grow modalities and offer different selections and tools in the integrative clinic here. And it becomes, on this journey, this walk, an opportunity for folks that come in to reflect on what is it that what path they want to take. And I will lay out many times what modality, treatment, whether it's hyperbarics, whether or not it's working on some lifestyle changes, whether or not it's our new neurofeedback device, or even now Ozone. We want to create a unique path for you and be supportive to you in that pathway and be that home, be that place. The other thing we a lot of times we can get sideways, and this happens to all of us. We go through the holiday season, and many times I've talked about gluten and things like that, things that can inflame us. We're here to also encourage, to say, hey, we get it, and that's life, but we are here to cheerlead and say, let's get back on the horse, and let's do this again and continue to feel better. But I tell you, the ozone, Dave, we've been going with that for maybe about 6 to 8 weeks now, and I will get into the details of ozone therapy more and more as we go along this spring, but then the rest of the winter. But it is continued, almost like the hyperbarics, to blow my mind. And one really quick, two really quick returns and hope stories for folks that have utilized ozone. One was a gal, she texted me last night. She's had chronic back pain, and we're starting some ozone injections on her. Again, ozone is a gas, and it is something that is extremely very gentle on the body. It's not your typical steroid that we think of when we're injecting a joint. But there's a whole science and reason why it works. But in short, it really bolsters the immune system and decreases inflammation, increases oxygen to that tissue as well, which is a good thing. And she texted me last night. She's like, this is the best I have felt with my back in ages. And she's like, I can't wait to see how I sleep tonight. So that is one approach we can take for pain for you, is what we call prolozome injections. And those things, we can do those all different parts of the body, joints. We can do subcutaneous, do scars. There's so many different benefits to it. The second story was a gentleman that he's had about 10 IV ozone treatments now. And he's got some chronic issues, chronic disease state going on. And it is after he has done probably 40 hyperbaric chamber treatments, we've added in the 10 ozone, and that kicked it up to the next level for him. He is feeling better than he has in years, more energy, sparky brain, just phenomenal. So that right there is some pretty great early returns. As well, the other benefit for ozone for somebody that is, a lot of the COVID cough and cold going around right now, and doing an IV ozone treatment, or the other great thing, Dave, you remember back, we used to go to the doctor for the penicillin shots.
Yes,
Doc, yes. I'm sick. Got to get a shot of penicillin. And back in the day, I remember my grandparents saying, that just fixed everything. Well, we didn't have a ton of antibiotic exposure at that time, so it really was pretty effective. But if we're doing that on a regular basis, we're kind of knocking out the good bacteria in the gut. And so another option, and this was done actually during COVID by a family doc in Detroit. He would do intramuscular ozone shots, and he said that worked incredibly well. And so that's another option for, instead of that old shot of penicillin, just doing an intramuscular shot in the old buttocks with ozone. And the benefit of that is that it's antimicrobial, and so it's anti-inflammatory, boosts the immune system, but it doesn't knock out that microbiome in the gut. And it is just a quick, lickety-split, about 2 minutes, and we're done. So another really nice, it's good to have options. Always good to have options to choose from.
Yeah, absolutely. And you've talked about that many times, tools in the tool belt. And the thing that we've talked about so much is peeling back the layer of that onion, getting to the beginning of the process of the health journey, because we've talked about how people come in and you look over their medication list and you find out somehow, some way they ended up on like 5 prescriptions for blood pressure. Well, how did that happen? And the same goes for like SSRIs. People walk into their doctor and they're like feeling, I'm depressed, I'm anxious, and they walk out with an SSRI, and all of a sudden people have a medicine cabinet just full of stuff. And the one thing, especially when it comes to pharmaceuticals, that you need to be so careful of is the interaction of medicines. Because if you're just taking one, that's one thing. But once you add another, there's potential interactions in these pharmaceuticals. And so that first one might not now work as good as it was intended. So that's why folks come to see you, so you can maybe weed out some of them and get the people feeling like they're living again, just not surviving.
Absolutely. Sometimes those pharmaceuticals can be a bridge for us until we peel the layers off and figure out, okay, where's our body out of balance? What are these different modalities? What nutrients are we missing? What's inflaming us that we're eating? Whatever it may be that is causing to imbalance or inflammation. Yeah, sometimes those pharmaceuticals are there as a bridge, but in many cases, it's nice if they don't become a chronic crutch forever. Now, again, sometimes there's not many ways around that, but in many cases, there are ways around that. And so, absolutely, we want to try to get you down off all pharmaceuticals if possible, but if we can get you under 4, that's an initial goal for most folks that come in to see me, as I want to get them under 4, because over that number, you start to compound, like you said, side effects, and you can get what's called polypharmacy, and it's all these interactions, and basically it becomes a mixture of who knows what. Mm-hmm. And so, but in many cases, it's in the end something that's not the best case scenario for the individual if they're on their journey of trying to get their body into balance.
And we need to be careful here, because we don't want people to think we're anti-pharmaceuticals, because we both believe there's a place for those. I recently saw a documentary on Gunnar Esiason and cystic fibrosis, and I'll tell you what, they came up with a drug just in time to save his life. It was extraordinary. Right. So, I mean, there is certainly a place for pharmaceuticals, but
absolutely.
But you don't throw them out there like they're candy.
Exactly. Again, it's all about the balance, and that's why we are an integrative clinic. We do a little bit of both of the traditional and the holistic, and try to find that bridge in what's ever best for that individual. What do they want to achieve? Do they prefer to stay on more pharmaceuticals and just come in because they like our atmosphere and our team? That's fine. I'm absolutely okay with that. But other folks, that kind of are a mixture between the two, and then we have others that say, Doc, I want to get off all of them. And so, we're here to assist you. You're driving the ship, so to speak, and we're here to help guide the process in an environment that's supportive and I think results driven. We've worked with a lot of folks over the last 3 years, and we have worked with a lot of we've seen a lot of really positive outcomes that have been blessings to everybody involved.
Yeah, certainly have. All right, so if folks want to come see you, how do they do that?
Yeah, I invite you to take action today. Give us a call, schedule an appointment. You can always do a complimentary discovery call at 712-339-6024. You can come in and take a tour of the clinic. We're happy to let you see the space and meet the team. And again, we're right next to Highway 71, 3305 Berquist Avenue in Spirit Lake. So easy to find. and we're ready to get working with you on your goals and feeling your best self as we head into 2025 here.
Very good. Dr. Meyer, it's always a pleasure. Happy New Year to you, your family, your entire team, and we'll talk to you again next week.
Sounds great. Be well, everybody.
Take care. Thank you, Doctor. Dr. Bradley Meyer, Okoboji Wellness Clinic. You can find them online as well, okobojiwellnessclinic.com.